contacts. Until recently, your only other option has been LASIK surgery. New technology offers a happy medium, and it all gets done while you're sleeping. Here with more, please welcome Dr. Julio Arroyo from Eye Health Consultants, along with patients Mary Ann Spencer and Aminophis Mitchell. Hello there. Julio Arroyo, I should say. All right, so before it's either LASIK or glasses and contacts. What were you wearing that was kind of an issue for you?
My bifocal glasses.
Oh, bifocals,
oh,
yeah.
I was so fed up with trying to find them, keep them clean. It was getting to be a very unhappy process.
Yeah, and bifocals are something that takes time to get used to.
Absolutely.
Also. And for you?
Oh, yes, ma'am. I had glasses and contacts, and my contacts would just fly out, and my glasses would get knocked off, especially when I'm playing sports. And so these corneal moldings, they really helping me.
Yeah, all right. So this is pretty amazing stuff right here. So let's explain first of all, let's explain if somebody's nearsighted or farsighted, what's actually happening with the cornea.
Well, we basically change the shape of the cornea. Just instead of destroying corneal tissue, or I guess burning, pulverizing, make the tissue go away, we just mold it. We just change or reposition the tissue in such a way that we change the curvature of the cornea.
Yeah, so, with the glasses and contacts, we kind of trick the eye into thinking that it's seeing correctly. But as I mentioned, there are some inconveniences with that. And then, of course, with the LASIK, you're right, you just completely change that. But then the corneal molding, how does this work?
Well, we use
The distance was improved, and Dr. Arroyo was a little, oh, Mary Ann, that couldn't be that fast. I'm just telling you. And by the third day, when I went to put my bifocals on, it was overcorrected. I had to take them off, and I was able to get up in the morning and check my iPhone, check my iPad, whatever.
Yeah, because like right now, you can read anything you need to read up close. And then
Yes.
for you?
Yes, ma'am. I used to wake up with trying to put in the contacts, and it would get irritating. It used to hurt. I used to scratch my eyes a lot. Used to get eye infections. But with the moldings, I just wake up and I got 20/15 vision.
Well, 2015,
Yes,
so that's even better than 2020 there. So I guess it's almost like an Invisalign for teeth. This is like the Invisalign for your eyes.
Pretty much, it's been called that way, yes. But actually, you know, braces is something very common in kids, and what we're doing corneal molding is more than the convenience of not having to wear contacts or glasses and during waking hours, but actually what you're doing is protecting the eyes of these kids from getting worse. So myopia is categorically going to get worse over time during your developing years. So what you're doing with corneal molding is to prevent that from happening.
Oh, that's
so
interesting.
you are protecting the kid's future.
Yeah,
so which is huge.
So when a child is diagnosed with having some eye issues at a younger age, chances are, you're saying it could get worse over time. You kind of interrupt that.
Correct. It's going to get worse when you're myopic. You wear glasses or contacts, it's simply going to get worse. So this is now becoming the gold standard to prevent the myopia from getting worse.
Yeah, so you literally sleep on it. How long would you have to wear these? Is this something that's kind of part of a maintenance program? You have to have these always?
Well, since it is a reversible process, you have to put them at night. At the beginning, you put them every night. Many patients, or after a few months, to just wear them average 3 times a week, 4 times a week, and that's it. Yeah.
All right. So who's a good candidate for corneal molding?
Well, 10 to 70, as long as you don't have cataracts or any particular serious eye disease, and you have healthy eyes, you can do it.
So especially good for kids. You said 10 to, was that 7?
Well, I would say, because we have patients that are 70 years old.
Oh, 70.
So,
I thought you said 10 to 17.
70.
And I was like going, 17? Well, I guess I'm out of that one right there. So, but yeah, okay. Yeah, so, but especially good for kids, but one of those things, again, that can become that maintenance program. People with allergies, dry eyes, athletes, all that type of stuff. If you have that inconvenience with contacts and glasses, this is a great way to deal with this. How long has this been out?
Well, it's been out since the 70s, really, last century, but it's becoming, I guess, mainstream during the last, I guess, 10 years. It is approved by the FDA, and now we have the technology to do that was envisioned 30 years ago, but we can do it because the technology wasn't there. Okay. But now we can do it.
I am in, because I'm having a little trouble reading that prompter these days. All right, Eye Health Consultants has a special offer. You can get $300 off corneal molding when you mention Great Day Houston. You can call Dr. Arroyo at one of his 2 locations to book an appointment. In Houston, call 713-697-7500, 713-697-7500, or in the Woodlands, call 281-419-3355, 281-419-3355. You can also check out their website, eyehealthconsultants.com. And by the way, how often should we get our eyes checked? Because a lot of us come in only when we have a problem.
I know. Well, once a year is a good place to start.
All right.
Yeah.
Thank you very much.
Thank you, Deborah.
Well, a 28-year-old woman recently wrote an article about how she underwent liposuction at the age of 18 and regretted it immediately. She said she was ashamed and embarrassed about it for a long time. 236,000 teenagers underwent cosmetic procedures in 2012. That's up 2% from the previous year. So today on Facebook, we want to know, in what instance would you allow your child or teenager to get plastic surgery? Log on and let us know what you think. We'll share some of your comments a little bit later on in the show. Think back pain is normal, just a part of aging? Well, it's not. The latest technology that can fix your pain for good when we come back.